Hi, everyone, and welcome to the National Council of Urban Indian Health's Peer-to-Peer Solutions Center, UIO Technical Assistance Support, focusing on RPMS data capture guidance for grant reporting. My name is Tiffany Stark, and I am NACUI's, or one of NACUI's, I should say, Public Health Program Managers, and I will be your host today. So I'd like to take the time to thank you for volunteering your time to join us in today's discussion. We at NACUI appreciate your willingness to share your UIO's experiences with your health information technology and electronic health records. We do understand that this could be a sensitive yet very important topic, specifically during the COVID pandemic these last 3 years. This is a safe place, and feel free to share as much as you feel comfortable sharing. Next slide. So again, thank you so much for joining us. We would also like to note that your feedback is very important, and it will allow for us to further understand your HIT and EHR needs and how to better support them. If you do have any IT difficulty during today's call, please chat directly to Comms and Events, and Lamar will further assist you. And then also, finally, if you could, please enter in your name, UIO or external organization, and any tribal affiliations into the chat box. That way we get to know each other and also count your attendance. And then some quick housekeeping items before we begin. Please, if you have video capability, enable your camera. This helps to create a more interactive environment. Also, please note that your microphones are muted, but you have an opportunity during the open discussion to have any questions answered. You can also raise your hand at the bottom if you'd like to be called on, or just unmute if there's silence and pop in. Our chat box will be monitored as well, so please feel free to drop in any questions or comments throughout the presentation, and we will address them at the designated time. And as you may have noticed, this session will be recorded for educational and quality improvement purposes. And also just to mention the evaluation reminder, if you could please take your phone out and scan the QR code, or we have the link provided as well in the chat box. And then just a quick acknowledgement that this project is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $100,000 with 100% funded by CDC and HHS. Next slide. So just a quick background if there's any new folks joining us today. So NACUI is the only national representative of the 41 Title V in Urban Indian Organizations, or UIOs as we like to say, under the Indian Health Service in the Indian Health Care Improvement Act, or ICHIA. NACUI strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality healthcare centers. And a quick look at the agenda. So we do have a presentation from our subject matter expert, James Spillane. Then we'll move into an open discussion, and then we'll conclude with some upcoming NACUI events, funding opportunities, evaluation, and wrap up. So at this time, I would like to introduce our subject matter expert. So James Spillane is joining us as our health information technology subject matter expert. James is the CEO of Health IQ. He has extensive knowledge in health information technology and EHRs, and he has served on several national committees, such as OIT Information Systems Advisory Committee and faculty for the IHS IPC/QILN Collaborative. So at this time, I would like to hand the presentation over to James, and please share your favorite emoji in the chat box to welcome James.
Cool. Get some emojis going. Hey, sorry folks, I don't have my video on right now, because when I had my video on, you got Tiffany and Emma sounding a little bit gurgled, and I didn't want to like cut out. So I'm just going to keep it really simple so I don't cut out on you guys. Thanks for the emojis. Thank you. So my name is James Spillane. I'm an improvement advisor by nature. I also have I have a background doing clinical applications work and health information management. So I've kind of got to touch all of the whole entire healthcare system. And that's kind of actually what I'm doing here right now, currently in Fort Defiance, is I'm working on them getting certified as a patient-centered medical home model. So that's literally just touching everything. We're looking at, how's your billing going? How's the ED functioning? How's the outpatient functioning? How's your inpatient functioning? And we're all just trying to improve the whole thing. So it's been a fun journey, going all over the country, working with different tribes and different sites and different urbans and different IHS facilities. Next slide. So, yep, there's all the places I get to go. So all these places that you have here on this map that I have touched, well, right here as stars and stuff, are all RPMS sites that I've been to. And I've got, they all have different reporting requirements, different grant requirements, depending on what state they're at or what region they're in and stuff like that. So for example, I work a lot with Michigan, and we work on the 3 Fires grant, which is a cancer survivorship grant. So what we do is we use RPMS to identify all the people who have had cancer, and then we try to manage and track their PAPs, their mammos, their coals, and all those things, because it's going to be a course more frequently, and treatment changes as you move on. Working in Missoula on tobacco cessation, working in places, throughout Montana, throughout Idaho, throughout Washington State, on various different grants. And so that's kind of what I want to talk a little bit today about, is extracting data from your electronic health record, from Moonwalk, or from iCare, which really can do everything. Next slide. So, wow, look at that. That's a lot of reports, right? So we're not going to go 100% in depth, but what I'm trying to do is let you know that there's a promised land here, that these things do exist and you can get these numbers. Now, granted, a lot of it is dependent on keys, but once at least you can go to somebody and say, hey, I need this key, or hey, who can run this report for me? So that's kind of what I wanted to show you guys today, is that we have a plethora, a cornucopia of reports out there that we can do. So just looking at this, you have clinical reporting system, which is GIPRA. You have the uniform data system, which is basically used for HRSA grants. So if you're a site that's like a federally qualified health center or a lookalike, you could actually run those reports and get a lot of that data. And it's pretty good data, by the way. I'm actually using that data for the patient-centered medical home accreditation here at Fort Defiance. You got iCare, which can pretty much run anything. You have stuff within iCare that you can look at HIV, STD, Hep C. You can even find out who are all my COVID patients who are high risk that need an immunization or a booster. We have immunization package, tobacco cessation, diabetes and diabetes nutrition, behavioral health, women's health, well child, workload and productivity. How many people are these providers seeing? What is our workload? You can do revenue cycle management, PGen, VGen, and QMAN. All right, next slide. So I just threw this out there spitballing, but these are some of the, right now, currently, these are some of the grants that I'm currently working on. You guys might have your own grants that you're working on in your own, areas that you need a report for. And I'm pretty available 24/7. So, well, that's not 100% true. I'm flying around a lot and driving around a lot, but I can help you with this. So if you need one-on-one help and you need hey, you're looking for this or you're looking for that, I can actually steer you in the right direction, or at least do how to and send it to you so you can see how to run these reports and where they're located at. All right, next slide. So when we look at healthcare system, so again, this is really good because that's the 3 Fires, comprehensive cancer consortium that we're working on, and this is that survivorship. But when we look at our whole entire healthcare system in Indian health, in the urban setting particularly, especially in urbans, because you can create a lot of these connections with the folks around you. So you could work with the Head Start programs, you can work with the food, grow your own food programs and greenhouses. You can work. So you could create whole entire things in RPMS and EHR that like where we had a garden in Missoula, for example. And so in EHR, I set up a schedule for basically the folks that would come in. I don't want to say patients because they're not really patients, right? For these clients that would come in, and we had it like a gardening schedule, and they could go in and use the garden at these different times. And then later on, we can go do a report and see how many people came to the garden. So I'm not like asking you guys to just think about like just the health center, but also think outside of the health center. And when you realize that, we do have a lot of outreach within our communities, and there's probably a way to do a report or to use that for a grant purpose, or you probably have a grant that's related to that. All right, next slide. All right, so now we're going to talk about if you guys know me, you see this one over and over again. I think I watched the TED Talk, but I just like the quote. And I really do believe that if you don't know, you don't know. And so you got to get in the know. And we live in the information society. We don't live in the Bronze Age anymore. So we need to know what we're doing and what our data is. And that will help us actually steer and make decisions, in our benefit for the organization. Next slide. Next slide. There you go. All right. So if you go into ihs.gov and you type in RPMS, and then in RPMS, you'll get like a thing on the side, and it'll say administrative packages, clinical packages, and something else, right? Or IT infrastructure or something. If you went into clinical, these are actually all of the packages that are on RPMS. So you have pharmacy packages, radiology packages, you have eye care, HIV, all this stuff is built in there, depending on your electronic health record and what they've loaded. You have immunization. Every single one of these, if you go to the next slide, and it kind of shows you, like if you click on it, the shot's not there. All right, next slide. All right, so I went to the clinical reporting system, right? So that's your CRS. That's where GIPR is ran out of. So every single one of these, if you open that up, will have a manual. And in that manual, it will tell you everything you need to do. So it'll tell you how to run reports. It will tell you the logic of why, what the report is ran off of. Oh, we're looking for colorectal cancer screening from ages 40 to so-and-so, see if they've had it done. It's telling you the CPT codes, everything. So that website alone, ihs.gov, going into typing RPMS up in the top right, and then going in, you can get a manual for any single report that you want to run. And every single one of those packages has built-in reporting ability. So I can run from CRS. When I'm in RPMS, I can pull the manual up and I can run my dashboard. I can run lists. I can run all sorts of stuff. And we'll give you a little bit of an example of what that looks like. So let's go to the next slide, please. So here's kind of what it looks like when you're in the back end. So I would pick 23. So I type in CI 23, and then I want to do a report. So I'll go RPT for reports. And then I'm going to do NTL for national. Next slide. And what this is going to give you is a page that looks like this. This is actually really cool, right? So not only can I do my DSH, my dashboard, my National GIPR dashboard, and that's like all your numbers and how well you're doing. And it's basically your report as of today, here's where we are meeting the GIPR measures. And they also tell you how many patients you need more to meet that measure, which is pretty cool. So, I need to do 38 more depression screens and I'll meet that measure. But the other one that's really important here is list, right? So I can say, I want a list, show me a list, and then I'll pick one like hypertension, for example, blood pressure control. And I'll say, show me all the people who are out of control that we need to get into control. I can do one for tobacco cessation, and I can say, show me all the tobacco users, show me tobacco prevalence, all the tobacco users that we have. Now show me everybody who needs that tobacco quit education. So all can be run right from here. So now I can print this list up and I can quickly give it to somebody and say, hey, start calling these people. Let's say we can get them an appointment, or you could just counsel them over the phone. All right, next slide. And that also has a forecaster in there, which is pretty cool. So you could actually see the patients for your today's schedule and what they're due for, which I really like. So this is an example of what it looks like once you go into like the list, for example. So I'm going to want to know diabetes, blood pressure control. So I just go in here, I select it, and then from there, I can go in and say, show me all the ones who need it or show me all the ones who already had it. So if I'm reporting on a grant that says, show me how many tobacco or diabetes, blood pressure control people you have in control, I would report that number. If I wanted to go get people in control, I would look for the ones that are out of control. All right, next slide. Right, so here's an example of what the Gipper dashboard looks like. And so what I do is in the back end, I go into CRS, I run that report, and then I come back over and I transfer it to something that's actually, because nobody wants to look at that RPMS stuff, right? So what I do is I just put it on an Excel spreadsheet and I try to make it look a little bit prettier, if you will. But here you could quickly tell like, oh, we've met 21. We have 4 more that we need to meet. And if you look at the right-hand column, you can see I need to do 56 more mammographies. And for colorectal screening, they need 406. So I can tell you right away, this is a site that didn't have anyone near them that they could do the colorectal cancer screens. So they were kind of lagging behind on those numbers. All right, next slide. All right. So then a lot of things that you can do with all these reports is you can actually put them into like bundles. So this, again, we're going back to information. Information is key here. This is what we call a dashboard. So I'm using multiple different types of reports. So the top part, I'm using eye care, and I'm actually finding these bundles, right? So I'm looking at these bundles. So I have a diabetes comprehensive bundle. For them, it was A1C that was holding them back. They were doing good at diabetic foot, diabetic eye, BP, nephropathy. They just weren't doing good at A1C. So you have to hit all of those in order to meet the measure. And they were not. So they were actually quite low. Once I pointed it out to them, you could see their numbers jumped up to 27. The other one was a cancer screening bundle and then the health risk screening bundle. Down below, we did a report on like expense cost and what it looked like. And we were trying to basically make sure that our visits were around a certain price range. We also were doing a number of active patients. So this was a new urban clinic that just opened up. So their goal was to try and grow their program. They were also impaneling their patients. So you can see they were at 80% and then they got pretty much up to 100%. We were also measuring third next available appointments and no-shows. These are all, that data just didn't fall from the sky. This was all done in RPMS. We were able to get all these reports and create a dashboard for the board of directors to kind of see how well we were doing. All right, next slide. There you go. And so then, so now we know these things and we knew that we needed diabetic. So like this was our way of having fun with this. So we wanted to drive our diabetic numbers and we knew that our A1Cs were low. So what we did is we did like looking at that last one, we created like scorecard. And so what it was is basically if you went or if you came to the diabetic clinic that week and we did it all week and we even brought in like a dentist and stuff like that. But we had somebody that specialized in feet. We had somebody that specialized in eyes. We had somebody that was a dental guy. And they all came and we invited all the diabetics to come to this clinic. And if you basically went in and you met with a consultant, you got a point. If you got your blood pressure and your blood pressure is in control, you got a point. If you went and got your cholesterol, you got a point. If you got all of those points, at all 10 points, you were entered into basically a raffle or a lottery to win. I think it was like an iMac and something like that. So it was really funny because like the first day of the clinic, we had like 50% no-show rate. The folks weren't there. The second day of the clinic, everyone heard that they were giving away stuff and they all showed up and they were actually like going down the hallway, like, where do I get my eyes checked? So we went from zero engagement to like full engagement real quick. But the reason we were doing that is because we were trying to drive this grant that we had, our special diabetes grant, and we were running low and we wanted to look good for this grant. So we really had to come up with creative ways to drive that A1C number. All right, next slide. So the uniform data system. So you remember I was telling you about like, wow, this stuff has a lot of weird demographic information, like can be used for some weird grant that you never think you would need. Well, it's here. So UDS, Uniform Data System, is where that lives. And this is also how we run our HRSA grants for the federally qualified health clinics and the lookalike health clinics. Next slide. And I don't know if it's just me, but there's a little latency on those. All right, cool. So here's all the things that we can report on. So we can find out all the patients' zips. We can find out their ages and their sex. We can find out demographics and characteristics. We can find out selected patient characteristics, staffing and utilization. This was always weird for us in Alaska because we would submit for this grant and there's like, you only have 200 patients. How do you have 45 providers? What they didn't understand is that we never had permanent providers. We were constantly rotating our providers in and out from, down in the lower 48. So, but anyways, you can see that. You can see how many full-time staff you have, how many providers, what their classes are. You can look at the staffing utilization. You can look at your diagnostic services, quality care measures, your health outcomes and disparities, and patient-related revenue. So you can see like how much money did we make from Medicaid? How much money did we make from Blue Cross Blue Shield billing and stuff like that? Next slide. All right. So here's like one of my first reports I ran. So I just ran this report here actually for fun. And the reason being is they're trying to find out where did most of the people live here? Because they were basically trying to figure out, are we seeing this place here? This is Navajo country, right? So they have people coming from Tuba City, Chinle, and all these other places to receive care here at Fort Defiance. And so they were just curious, like, how many people are we seeing from these other places? And so what it did was it just pulled up, here's all your people from this zip code, 87119, and then here's how many are not insured, and here's how many are insured, and it gives you a total population. Very useful information. All right, next slide. So remember I was talking about age, and you can see age. Well, here it is. So I'm now looking up every single age group, and I think it goes up to like 110 or something like that. But I can kind of start to break down like, hey, what are we, like when you look at these and you see what the age ranges are, you start to realize like, oh, this is like our main population right here from like, really what we're seeing is 35 to like 65 is our main chunk of people that we're seeing. And other places that might be different. Maybe they're more kid orientated. But what that does is allow you to focus your services on like, all right, these are the people we're seeing. Or it says maybe we need to expand our services. Why aren't these people coming in? All right, next slide. All right, so EHR, the RPMS just came out with another package quite recently, I think within this last year. And they have a whole new set of like sexual orientation and gender identity is a new part of it. So this was the example that was given in the manual that came out with that new package. So I just took a screenshot of it, but you can look in and see, all right, how many people do we have that are bisexual, straight, gay? And then you have like male, female, transgender, how many people identify as these different ones? And this is becoming more and more increasingly important because we actually do have grants for Two-Spirited and stuff like that, that we want to know these numbers. And we were never able to capture this. I mean, like literally you would have to put it like on an Excel spreadsheet. Now, for the first time, we can actually pull these numbers and see, oh, here's how many we have. All right, next slide. All right, so now we're looking at like we're going into eye care, and in eye care, we're going to look at some of the great reports that you can do there. So one of the first reports I always like to do when I come on site to a place, the first report I do is I say, show me all the patients in the last 3 years who've had at least 2 visits here. That's going to be my active population. So when I pull that number up and I see it, I go, oh, here you have like 1,000 patients per se. I can quickly tell where I need to go to work. And this is how I pull that report. So I go into an ad hoc search. I just call it national aggregated. I go into visit related. I pick a time frame. And then I say greater than or equal to 2. So I go and edit and I say, okay. And next slide. and you'll kind of see what we get when we run that report. So you'll come in, and this is what it looks like. So once you get that report going, you got to jump over to National Aggregated tab, because you'll probably open up in the patient list. You go to that tab, and once you're in that tab, on the left-hand side, there's a little thing that looks like a coffee filter. You filter for National GIPRA. So that's where you're kind of getting all your GIPRA information, right? Next slide. And you'll kind of see what it looks like coming up here. And that's what it looks like. All right. So just looking at this, I now have a clear idea of what I need to work on. And so if I was to ask you guys, what do I need to work on? You would probably say, you guys need to work on mammography, you need to work on nephropathy, and you need to work on immunizations. So that now becomes my focal point. I now can share this with the providers. I can share this with different folks and be like, hey, here's where we are. Here's our numbers. Let's go out and let's come up with a plan of attack or strategy to kind of raise these numbers up. And or this feedback is also telling you there might be a problem in the system. We might be not clicking it right, or we might be just putting into a progress note. Maybe we need to hit the CPT button for mammography, or maybe we need to put it into historical services. The other thing that this does for me is tell me that maybe I need to check out my adult immunizations. And or maybe I need to look at the logic for what a nephropathy is. And a nephropathy is like a GFR and a microalbumin or something like that. So there's 2 lab tests. And if you don't do both of them, you don't get a credit. So all that information is giving me feedback that I need to go find out what process is breaking down in the back end, because you aren't green on everything and then just red on a couple. Something's wrong there. So I'm going to go do a little research. All right, next slide. You guys, next slide, please. I don't know if I have latency or what.
Yeah, it's up.
Oh, okay. There it goes for me. Yeah, wow, I'm really far behind. So this is another one that I did. So I said, let me see all the patients that are assigned to Dr. Young. And as you can see, Dr. Young is really good at what she does. So what I did was I turned it into kind of like a report card. So we give our providers this every single month. We say, here's where you're at. Here's how you're doing. Here's where you're at. Here's how you're doing. And we're pulling all that information from iCare. And so we're creating these report cards that we can now, with multiples of these, we can now do run charts, and we can see, are we getting better or are we getting worse at what we do? Okay, next slide. And forgive me, guys, because it's like takes a couple of seconds for the next slide to show up here on my end for some reason. Hold on. All right. So here we are. So I just got it. So now it just shows up. So here I am going into iCare. And so I'm going to say, all right, I got this panel of patients that I'm looking at. So now what I want to do is I want to go into the care management tab. So here in the care management tab, this is incredibly important because I can run my whole entire diabetes audit out of here. I can run my HIV, I can manage my HIV patients from here. I can manage my Hep C patients. I can, if you can see there's the COVID right there. So we have multiple opportunities to look at these patients, where they're at and what we need to do with them, all from this one tab in iCare. So again, this is an incredibly powerful tool. And if you don't have it, you need to get it and you need to start using it. And there's nothing you can break in there. Next slide. There's nothing you can really break in here. So if you get iCare, go have at it and go have some fun and try doing different queries and creating different lists. You can't go wrong. So here's one, for example. I just basically pulled up all the diabetic patients and I hit the diabetes audit one. And the diabetes audit, it's like telling me like, hey, James, you need to do the diabetic foot exam for this person. And also they need a diabetic eye exam. And also they need a diabetic dental exam. And oh, by the way, they also need a depression screen. So I can tell where I'm at. And then if you go to the next patient down, I can see, oh yeah, they did have their eyes dilated. So it's basically telling me what I need to do for these patients for this grant that we have. And a lot of folks do have diabetes grant. Diabetes, for the most part, is like really funding a lot of Indian country. Next slide. So the diabetes diabetes money, a lot of actually this development of these programs is actually leftover diabetes money. So now we're going to go into Moonwalk. So you can go to the next slide. Moonwalk's pretty cool because like I do a lot of like, I like to look at workloads and I like to see who's doing what. So here I'm picking a fictitious provider named Begay. So we're at our demo clinic right now, and I pick a Dr. Begay. And so I had to go in and create all these visits so I could like actually have a report to report. So here it is. So over here at this place, we're using our provider, and we can see how many visits have that, how many have been rebooked in this time frame from 5/2023 to 6/2023. And so I wanted a no-show report. So we had without rebooked appointments 6, 0 without, and 6 no-shows. So I was able to kind of see, oh, we had 6 no-shows show up in this provider schedule. All right, next slide, please. All right, here's another one that's pretty cool. I wanted to look at productivity. So you go up to, if you look at the top part, it's looking at the workload. So again, we're picking a fictitious clinic. We're going over you guys would actually be picking your real clinics. And so what you would do is you would go 5/1/23 to 6/30/23. And then there you can see from those certain timeframes from that date, these are how many appointments they had. So they scheduled 48. They had 6 overbooks. They had 6 no-shows. They've had 16 canceled for a total of 54. And then it goes down and just kind of adds it all up. And then you basically got a total. All right, next slide. All right, so in Alaska, we used these reports and we could see that we were having problems. So we were able to focus on what we needed to focus on. And we knew that cancer was our problem, and colon cancer particularly. So that's what we started to do. So let's go to the next slide. And then as we started to focus using this data, using this information, we would actually see systems change. So when I got to Little Traverse Bay Band, we started running these reports. We started sharing it with everybody. We started troubleshooting the problems that we were having. And then as you can see, within just a quick time frame, and you got to remember, some of that was during COVID, their healthcare system has greatly increased. There's one measure, the alcohol, that went down. And I think that went down because they actually lost their person who specialized in that. But for the most part, every single measure is up. And that's pretty outstanding. And a lot of that was just giving them the information back to the users, the end users. Next slide. And so remember how I said cancer was a problem? So we started looking at that. We started coming up with strategies. We started thinking about how do we engage? What ways can we get people here to understand the importance of it? We started doing PSAs. All this was coming from these reports that we had. But then what this allowed us to do was to go out and get grants. And we would go get grants for these things and actually increase the screening rates of our patients. So they would allow us to fly out to the Aleutians and to fly patients in from the Aleutians into Anchorage to actually get these screens done, where we didn't have that. But we couldn't do any of this without the ability to pull these numbers and to like prove and justify what we were doing. Next slide. All right, and then later on, and you guys seen this slide before, later on we started publishing articles on what we were doing. But again, this was all driven by we wanted to better care. We had the information. It was the first time really, because if you think right before this time, and a lot of you might remember this, we were in paper charts and we moved into the electronic world. And now for the first time ever in the history of medical history or any history at all, we had access to all this information. And so if you start using the information, you can do amazing things in your healthcare system. Next slide. And I'm just waiting for it to come up. So here's an example of the huddle. So we've talked about having policies. We've talked about creating teams. We talked about all these things like the electronic health record and how to simplify and streamline it. And at the end of the day, it also comes down to communications. So right here, Christina is basically the PCC director, or the primary care department director, and she's doing her morning nurse huddle. And she's saying, hey, This month is Breast Cancer Awareness Month. Make sure that you guys are looking at your patients, seeing who's coming in, who's due for what. So they've already done the chart prep. They've already looked at it and scrubbed those files. And then also we have Joint Commission coming later today. So make sure you don't have your soda bottles out and all that junk, and keep your areas clean. All right. So information is key here again. Next slide. And I'm just waiting for it to come up. I'm so sorry for this. Again, teamwork too. So you could take, like, if you have a good team set up, you got the right people in the right positions, you should be able to run these reports, get all this information out, and have dedicated bodies to it. All right, next slide. And this is just an example, like they have a behavioral health consultant, they have a dietitian. So what reports do you think they'd be running? They're looking at all the alcohol screens, they're looking at the depression screens, but they're also looking at all the people who have a high BMI and who do I need to call and who do I need to do counseling on. So in that team setting, that patient is actually going into the room, and that's at South Central Foundation. So the patient doesn't move, everybody goes to the patient. That's how they do it. So that dietitian would actually go into the room and give them a nutritional counseling while they're at that visit, but they don't know unless they have that report in front of them. And then what you can do later on, like I said, is like, all right, we have these grants that we're trying to meet. We have the GIPR report that we're trying to do. Why don't we try to put these in easy grab places for the MAs to grab? So when they're grooming the patient, they can just go boom, 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 do it all at once. All right, next slide. Right. And then we have in the EHR, you actually have things that are telling you, hey, you need to do the alcohol screen, you need to do depression screen, you need to do the colorectal cancer screening. So our EHR is trying to help us meet these grants and is trying to help us to better our GIPRA. And if we just kind of listen to it a little bit, or we will actually succeed and do well and take care of our patients. Next slide. And I really do like that fact. I'm actually training that this week here at Fort Defiance. And then you have multiple places where you can see this information kind of gleaming at you. So you can see, like, right here in the right-hand corner, you have the reminders. So you have like the alcohol, colon, depression, domestic violence, tobacco screen. So I can see that that patient's already due before I even see the patient. Next slide. So like if I'm trying to meet that, I'm literally scanning and looking in my schedule in eye care, who is all coming in and what are they due for? So then what I'll do is I'll create something similar to this and I'll print it up. And what I'll even do is, so I'm going to sort all the people who are coming in this week and what they're due for. And then what I'll do on the right-hand side is I'll go ahead and add next appointment date and time, and I'll sort it by chronologically, so I can see, like, oh, I got a lot of people here that need a lot of care. So as they are coming in, I already know that I have to order a colo, I have to order a PAP, I have to order a mammo, stuff like that, all in an effort to improve those quality measures and help save lives. All right, next slide. And I'm just sorry about the latency again. I'm just waiting for it to pop up. Oh yeah, so then here's what I do is I print it out, and then I can go ahead and have either the front desk or reception, or I can send out letters due saying that you're due for this. So if you are working on like a cancer survivorship grant, or you're working on, and you can go to the next slide. If you're working on any of these things, these reports are extremely helpful because you can quickly go out and identify them. Who is due? How many have we done? How many have we not done? And let's get that taken care of. All right. I'm just waiting for the next slide. Sorry. What I'm seeing right now is that panel. Oh yeah, and then focus. Let's go to the next slide. So that's kind of what that picture you saw of Christina, that's what she was doing. She was focused on mammos. So this one right here is I wanted to identify all the people who are due for an alcohol follow-up. Like, so they might have tested positive for an alcohol screen. So we needed to do like some kind of follow-up with them. And that's what you would call SPERT. And then here's how we break it down just for ourselves. This one's actually still in use. Even though this is 10 years old, we still use this to this day, over and over again. And it's so much so that people don't even need this anymore. They just know that September's depression screening. They know that October is breast cancer screening. They know that November is diabetes, and they focus. So they're always focused on those measures, on those timeframes. And so if you need be, this is a good way to break that whole, all those measures up. This is a good way to break it up. Next slide. And I'm just waiting for it. All right. Yeah. Again, you can go to the next slide. Put it in an easy place for the patients to grab or the providers to grab. So we knew we needed to work on tobacco quit for tobacco cessation, and we knew to work on alcohol follow-up or expert. So we put those in places and we trained our staff on where to do it so we could meet those grants. And then again, just one more follow-up. This was San Carlos, just by simply like, well, it wasn't simple. We created care teams, we improved the EHR, we did a lot of things. But I think one of the main driving forces behind all of that was the fact that we actually started being very transparent with our numbers and started sharing, because you can't correct yourself if you don't know what you're doing wrong. All right, next slide. And yeah, I think they're loving it. This is now data, and these reports are a daily part of their day, and so much so that people are actually asking for other reports. And they're asking for things that are so abstract now that I don't even know if we can pull a report on it. But they're really on top of their diabetes numbers. They're really on top of their A1C. They're top of their blood pressure control. This 5-6 years ago was like really, they didn't even know where to look for these things. Now they're totally managing these patients. And then next slide, and you can see it helps out overall and all the things that they're working on. But really, I think that's it. That's all I got. I think the next slide is going to be the thank you. So I hope you guys did learn something. And I hope you at least have questions of where the heck do I get that report and how do I get that report? So that's all I got for now.
Thanks, James. So now we'll move into the open discussion. So if you have any questions for James on any of the reports that you do at your site, please take the time to ask those now. And we also have the evaluation reminder up as well. And James, I had a question while folks are maybe thinking of some questions. Are there any like quick tips, or is there a key that may be helpful?
What did you say? Quick tips, or what did you say?
Yeah, like if there's a quick tip sheet to help with reporting, or if there's a sheet that has some keys that may be helpful.
Yeah, you're kind of breaking up. So I heard the word keys, and then I heard quick tips. No, so first of all, I really think people should go back to their desk. I shared with you the template of all the keys needed for all the different reports, but really whoever is your clinical applications coordinator, or whether you're going through an area office or whatnot, you could basically reach out to them and say, hey, I need a key to the diabetes report, or hey, I need probably the most important key you need is eye care. And that's like a BQI key, but you need to ask for the eye care and eye care key, because that's probably the biggest bang for your buck. That's going to be your best reporting tool that you have. You can figure out almost every single thing in eye care. So I can see who's on what med, who's had what immunization. I can look at CPT codes, ICD-10 codes, show me all the people with this diagnosis. I can look at everybody with a lab value of this, a lab value of that. I use it a lot for like a Hep C grant that I work on, where I can identify all the people who've had a Hep C test with a high value. So we need to get them on some treatment. Your biggest bang for your buck is always going to be running your CRS GIPR report and running your eye care reports, getting eye care up and running. Because you can kind of see where you're at as an organization, and then you can dig in with eye care and find out who, what, where, when, and why. And for that, you will need a key. So you absolutely need a key for that. And so you'll need to ask permission, or like ask an area officer, your CAC, hey, can I have access to this? Hope that was helpful.
Thank you. Any questions or comments for James? Feel free to put it in the chat too if you think of anything, but we could proceed. So we do want to provide the reminder that we do have technical assistance requests on our website. So that's nacui.org/TA. So that's super helpful if you would like some one-on-one time for any questions that you may have. And then we also have some upcoming NACUI events. So we have compassion fatigue training on July 11th. We have another peer-to-peer solution center on July 18th. There's MMIP compassion fatigue training on July 28th. Standing Together to Address Urban Indian STI Disparities, that's on August 2nd. We have IPC and Urban Indian Behavioral Health Settings on August 9th, and then a peer-to-peer solution center on August 15th. And we also wanted to make note of the NACUI Infection Prevention and Control Assistance Center. So we do have a QR code on this slide as well for more information. And for funding opportunities, we still have one spot available for the Electronic Case Reporting UIO Subgrant Award for year 2. So the UIO would be awarded up to $84,600. And we have the link to the application and also the QR code. And again, just a reminder for the evaluation, that's super helpful for us in the future to better support you in your organization. And again, thank you so much for attending. If you have any questions, please reach out on the website or to any of us on the email. So thank you so much and have a great rest of your day.